Making Every Contact Count is a national HSE programme aimed at preventing chronic disease. Participants complete 8 modules on HSeLanD e-learning on topics such as tobacco use, harmful alcohol and drug use, physical inactivity, unhealthy eating, obesity and mental health.
Chronic disease is becoming so prevalent in our health industry at the moment. Prevention is always better than cure. With this program, you are getting the training to understand how to start that conversation, and that's why Making Every Contact Count is the best program for chronic disease prevention.
It's broken up into 8 different modules. So as a busy healthcare professional, it was very easy to dip in and out of each module. You know, as a nurse, I felt like I had a background knowledge of these chronic disease prevention strategies, but actually by doing the e-learning program, it has really strengthened my knowledge in these different areas.
When people come through the door for smoking cessation, it's not only tobacco that we work with, it's also things like mental health, weight management, stress management. So having Making Every Contact Count training done, it's like having an imaginary toolbox kind of that you bring in with you to all your sessions that you can just pull from depending on which client comes through the door.
I found the online learning modules were great for creating new examples and different scenarios that you wouldn't think of yourself. I think when we think about making every contact count, you might come across the more obvious ones such as like smoking or alcohol, but the online course brings in a whole other different types of scenarios that prep you for the wide variety that you see in patients.
After participants have completed the 8 modules on HSeLanD, they can register to attend a half-day workshop entitled Enhancing Your Skills, where they will get to practice what they've learned and also use their brief intervention skills.
I really loved the workshop. It was really great because we were able to find out loads of resources which are out there and how to do signposting. Having that simulated scenarios was great as well. So we learned loads in the workshop.
It was a half-day workshop and it gave us a chance to practice our skills. It also gave us the opportunity to work around difficult conversations and navigating those conversations for clients who may be kind of stuck in a rut.
I feel now when I'm with my patients on the wards that I can pick up on, you know, something small they might have said, that I can now approach these conversations with the patients in a non-judgmental way, in a very natural way.
I found the workshop was a great tool to be able to practice the techniques that we were going to use with our patients. Topics like this can often be hard, particularly as I always used to think that I might jeopardize the therapist-patient relationship. But actually, after completing the course, I found that I had new tools and techniques and different ways to address it in a friendly, approachable and safe way so that I was able to maintain that relationship but also make those changes for the patient.
All this training is available free on HSeLanD and there are CPD points for both the e-learning and the workshop. We have developed a very comprehensive MECC Directory, which is all the information needed to refer clients.
I think that's the best thing which has come out of this. You are able to signpost to a patient where exactly you go. I learned that there is so much resources available out there for our patients.
I do have now the tools to be able to point them and signpost them in the right direction. I have names, contact details, everything at my fingertips.
The directory is a huge help to so many services out in the community that we may not be aware of. So having that directory there on the day to be able to look through and support people and refer them on to the right appropriate services is just great.
It means that all of us are linked in and are very much more aware of our MDT around us and our services around us. It means the transition between referring from one to another is much smoother, much easier and keeps everybody very local, which is very good.
So following on from their training, it's very important that when people go back to their workplace that they roll out the MECC interventions so that the public can benefit.
Some participants before the programme are worried about actually finding the time to make these brief interventions with patients. But through the programme, we learn how to seamlessly embed Making Every Contact Count into our daily practice. Another concern that some people might have before coming to the workshop is actually raising these conversations with patients. But what we actually know is that 92% of patients do want to make a behaviour change and they need support and guidance in order to do that.
I had thought about making changes, particularly with my eating habits and trying to lose weight because they were causing me problems. And I was very fortunate when I was in for an appointment. In nice friendly chat brought up, had I thought about my diet and making changes, and was extremely helpful. Well, actually I was very happy and I think relieved as well because I knew it was something I needed to do. So once she brought it up, I just opened it up and started talking to her about it. and was really able to get the right information.